So if we take a look at what the oxyhemoglobin dissociation curve looks like, just as a reminder, this is our curve on the bottom right-hand screen. And if you see on the x-axis, it's our partial pressure of oxygen. And on the y-axis, it is the saturation. And that's specifically referring to the saturation of hemoglobin. So how much hemoglobin has oxygen bound to it. If you notice at the very top flat part of the curve, I'm looking at the red line here, that's when we're just leaving the lungs. So our oxygen should be fully saturating the hemoglobin within the blood. And as you move from the lungs through the arterioles, you'll see that the oxygen saturation is going down because you're now delivering oxygen to the exercising tissues. What happens though whenever we go to high altitude is that our alveolar PO2, so the PO2 in the lungs, starts to approach the capillary PO2. So what happens is we're reducing that partial pressure gradient. And if you remember, for oxygen delivery, it relies very heavily on its oxygen gradient to deliver oxygen to the tissues, to move from a high concentration to a low concentration. Whereas something like carbon dioxide relies on a diffusion coefficient, so it's not as heavily reliant on whatever its partial pressure gradient is. So as you notice, when we go to altitude, we get a shift to the left of that curve to compensate for the fact that we have hypoxemia, which is causing low alveolar partial pressure of oxygen. So this is going to promote a longer loading phase of oxygen in the lungs to then hopefully fully saturate the blood before it is delivered to the tissue. So in this case, this saturation is trying, in a sense, to minimize the effect of the difficulty of oxygenating the hemoglobin in the lungs by extending our loading phase in this case. But it's not a perfect fix, but it does help. So if we take a look specifically at those gradients, if that wasn't making sense when I just mentioned that, we talked about the gradient at sea level being about 100 millimeters of mercury in the alveoli or in the lungs, and then about 40 millimeters of mercury by the time we reach the exercising muscle. So that gives us a gradient of roughly 60. Sometimes instead of 100, you'll see 105, and you'll see that gradient as 65, but they're all about approximations. If you go up into altitude, and the partial pressure of oxygen starts to drop significantly, so in this example we have 4,300 meters, what happens is our alveolar partial pressure of oxygen drops to just 42, and our muscle partial pressure of oxygen drops all the way down to 27. So now we have this very small gradient of 15 millimeters of mercury, and this can be seen on the figure on the right-hand side. So we've significantly reduced the oxygen diffusion into the muscle. So we're making it really hard, because of this very small diffusion gradient, to move the oxygen from the lungs to the exercising muscle. So what happens then from an exercise capacity standpoint is when the hemoglobin is desaturated at the lungs, we don't notice much effect. Instead, the fact that the partial pressure gradient at the level of the muscle becomes so small, now we actually notice a decrease in exercise capacity, because this is where metabolism is actually taking place, and we're actually utilizing that oxygen to produce ATP for energy. So one of the short-term adaptations that we have with acute altitude exposure, meaning you go out to altitude and what are some of the very first things that are going to occur? Well, one of those acute responses is actually going to be a decrease in plasma volume within the first couple of hours. And if you take a look at the figure on the right, you see we have blood volume, and notice that the blood volume is in gray, and you see that the amount of blood volume has gone down. And you can lose up to about 25% of your blood volume. And this should be concerning if you're thinking about the Fick equation, because if our blood volume goes down, that means our stroke volume is down, and our overall exercise capacity has also gone down. Now, what you will notice is that hematocrit will increase because of this. So if you take hematocrit, in this case, you're taking the total blood volume divided by the formed elements, or the red blood cells. So if you look at the bar on the left at sea level, you'd have the the total blood volume is about 6,000 milliliters, and the red blood cell volume is about roughly 2,000 milliliters. So it would be 2,000 milliliters divided by 6,000 milliliters. So in this case, the hematocrit would be about 30%. We're at 33%. Whereas if you look at the bar on the right, in this case, it's actually going to look like our hematocrit went up maybe to about 40% because of that loss in plasma volume when you do the math of formed elements divided by total blood volume. However, after many weeks, even months, a very long-term adaptation to altitude exposure is we actually start to see EPO being released from the kidneys, and this stands for erythropoietin. EPO specifically acts on the bone marrow to produce red blood cells. So it's trying to increase the red blood cell count as a way to increase the oxygen carrying capacity of the blood. And this is a long-term adaptation. So hopefully you're going to have this adaptation to, in a sense, try and offset this loss in plasma volume that's going to occur to try and increase your oxygen carrying capacity of your blood. Now, this is something that is highly regulated in sport because people will sometimes take their own blood out, or someone else's blood, in fact, and they'll infuse that blood into themselves to try and increase their exercise performance by increasing their hematocrit, because they're increasing the amount of oxygen that can be carried by the blood. And so this is something that's not allowed in normal sport, or competitive sport rather, and we actually have guidelines. I think about 55% hematocrit tends to be the cutoff of what is allowed. So some other physiological responses that we see is cardiac output actually goes up. And this should be a red flag because I've just told you that plasma volume goes down and stroke volume also goes down. But we see that cardiac output has gone up both at rest and at submaximal exercise, primarily because of a significant increase in heart rate due to an increase in sympathetic nervous system activity. So you have this fight or flight response that is occurring as you're going up to higher altitudes. And this is a very short-term adaptation. It only lasts about 6 to 10 days. So it wouldn't be beneficial for this to be a really long-term adaptation because it's rather inefficient for your heart rate to be elevated. So instead, following this short-term adaptation, we have a bit longer of an adaptation where our muscles actually get better at extracting more oxygen that's passing through the capillaries. And in this case, that's going to cause an increase in the AVO2 difference. So this is our long-term adaptation, whereas the increase in heart rate is our short-term adaptation. And this is going to help reduce the need for more cardiac output if we're more efficient at pulling the oxygen out of the blood. So the heart rate is able to go back down to a more reasonable resting value, or even submaximal value in this case. So as we consider exercise capacity as we go up in altitude, we've got to talk about what happens to VO2 max, and specifically what happens to the different components that influence VO2 max. So we know that the delivery of blood is compromised, specifically at the maximal intensities. So our plasma volume is going to go down as we go up in altitude and spend more time at altitude. We're going to be losing more fluid to the environment through our skin, as well as secreting more urine. Additionally, the sympathetic nervous system responsiveness is going to go down. So that's less signaling to the heart to increase heart rate. So we might see a blunted maximal heart rate in this case. Both of those things are going to combine to influence to have a smaller maximal cardiac output. Additionally, as we've talked about, barometric pressure goes down as we go up in altitude, which means the partial pressure of oxygen has also gone down. As we decrease the partial pressure of oxygen, that gradient between the environment and the partial pressure of oxygen in our muscle is also getting smaller. So for example, when we're on Everest and the partial pressure of oxygen is 53 millimeters of mercury in the atmosphere, it's only 40 millimeters of mercury in the muscle. So we've just decreased that gradient all the way down to 13 millimeters of mercury, and normally that's roughly a 65 millimeter of mercury gradient. So all of these things combined are going to contribute to decrease our VO2 max as we go up in altitude. And that decrease is going to be graded. So if you're in Denver, there's a very slight decrease, versus if you're on Everest, there's a very big decrease in your VO2 max. Some other things that happen when we go to altitude are a very robust increase in our metabolic rate. And this primarily has to do with hormone secretion of our catecholamines, so our epinephrine and norepinephrine, as well as our thyroid hormones, our thyroxine, which are going to increase our resting metabolism. And so in this case, you actually have to increase food intake to maintain body mass, because you have basically a furnace that's burning faster and more often, requiring more wood. In the equivalent, you're requiring more food in that analogy. We're also having a greater reliance on glucose versus fat, which would not be advantageous in this case, but makes sense since glucose is the macronutrient that we can use in the absence of oxygen availability. So we're going to shift to use more of that. And that's because we're going to then use more anaerobic metabolism, which also means we're going to have more lactic acid production. Something that's really interesting, though, is while we should have an increase in lactic acid production based on our reliance on glucose and our increase in anaerobic metabolism, if we look at someone over time with longer term exposure to altitude, we notice that lactic acid production starts to go down. And we actually don't know why this happens. So we can't understand the cellular mechanisms that's supporting that decrease in lactic acid at this time. So as we've mentioned earlier, dehydration is going to be accelerated as you're experiencing or subjecting yourself to altitude, even if it's acute exposure to altitude and you're not spending a prolonged amount of time there. You're going to give off more fluid from your skin to the environment because that air is very dry, and you're also going to be secreting more urine. If you start exercising and you're sweating to thermoregulate, this is going to exacerbate that situation. So generally, we recommend that people increase their fluid intake, something on the par of 3 to 5 liters per day, to try and combat this accelerated dehydration that's occurring. The other thing that's interesting about being at high altitude, we know from the previous slide that our metabolism is accelerated. But oddly enough, our appetite goes down. So you end up pairing these two things together to get about a 500 kcal deficit per day. Now, if you're trying to lose a little bit of weight, that could be kind of nice, right? Those two things are working together to decrease the amount of food that you want to take in. But often people, if they're at altitude, they're there for some sort of expedition or some sort of athletic event. And in that case, they actually have to be very careful that they're taking in enough calories. And sometimes they won't be hungry, but they have to be educated that they need to eat sometimes even when they aren't hungry in order to combat this deficit that occurs. Additionally, as they're at altitude and they're producing more red blood cells, we want to make sure that they have enough available iron and they're not becoming anemic. And so for many people, this will result in taking an iron supplement, both leading into their exposure to high altitude and while they're experiencing that high altitude, to make sure they have ample amounts of iron in their blood. This is one of those great summary slides that highlights all the different systems that are affected by altitude, so the respiratory system, cardiovascular, metabolic, as well as renal, and what happens to those systems both at rest in the center column and on the right whenever someone is doing submaximal exercise.